I'm a paramedic in Oslo. And last month I watched an American tourist refuse to get into our ambulance because we wouldn't tell him the price. He'd slipped on ice outside the opera house, clearly hurt his ankle, couldn't put weight on it. My partner brought the stretcher. The guy's first question wasn't about his injury. He asked what this cost him. I told him it's free. He stared at me like I'd offered him suspicious candy. "What's the catch?" He said. "There's no catch. It's public health care." He actually laughed, said he'd rather call an Uber than fall for a scam. Took him 15 minutes of sitting in pain before he finally agreed, muttering about hidden fees the whole ride in Auckland. My cousin drove a taxi past an American couple flagging down cars outside a pharmacy at midnight. The woman had twisted her knee badly, leaning on her husband, both looking panicked. He pulled over, asked if they needed help. The husband said they needed a ride to the hospital but wanted to know his rates first. My cousin said they should call an ambulance. The guy shook his head, said they couldn't afford thousands of dollars. My cousin explained that ambulances here cost maybe $60. Often covered by insurance or ACC, the American didn't believe him. Insisted on taking the taxi because at least we know what we're paying. My sister works reception at a clinic in Toronto. An American exchange student came in with a deep cut on his hand, wrapped in a bloody t-shirt, asking how much a few stitches would run him. She said he should go to emergency. He refused, said he'd already Googled that a visits cost thousands. She tried explaining that he wouldn't get a massive bill, that he had provincial coverage through his student visa. He didn't trust it, demanded to pay cash up front for just the stitches, no other services. Took 3 staff members to convince him he wouldn't be financially destroyed by getting proper medical care. These stories keep piling up from every country with public health care. Americans abroad, injured or sick, terrified of ambulances and emergency rooms, making worse decisions because they can't believe medical care might not bankrupt them. I worked the front desk at a hospital in Melbourne, and this American backpacker stumbled in, holding his arm at an odd angle, clearly broken, pale and sweating. He walked straight past Triage to my desk, pulled out his credit card, and asked what the damage would be for an X-ray and a cast. I directed him to Triage first. He refused to move until I gave him a price. Quote, "I need to know if I can afford this before anyone touches me," he said. I explained that he'd be treated regardless, that billing comes after. He thought I was lying, said every hospital in the world charges up front. Started telling me about how Australian healthcare was famous for being expensive, how he'd budgeted $3,000 for emergencies. A nurse finally walked him to Triage while he kept asking her to ballpark the cost. His total bill was $0. He came back an hour later, arm in a cast, demanding to see an itemized bill because nobody works for free. My brother's a pharmacist in Dublin. An American woman came in, asking for antibiotics for what sounded like a serious infection. No prescription. He said she needed to see a doctor. She asked how much that had cost. He said probably nothing. If she went to a public GP, maybe €50 private. She didn't believe him, insisted Irish healthcare was expensive because it's European. "I've done my research," she said. "Europe has great healthcare, but it costs a fortune out of pocket." He tried explaining the public system. She cut him off, said she'd rather buy antibiotics illegally than pay hundreds to a doctor just to get a prescription. He refused to sell without a script. She left angry, came back 2 days later sicker, finally saw a doctor, paid €30, got her prescription. Told my brother she still suspected the doctor undercharged her. By mistake, and felt guilty about it. I run a medical clinic in Wellington, and we had an American engineer working here temporarily who came in for a routine physical his company required. Standard checkup, blood work, the works. Afterward, he sat in my office anxious, asked when the bill would come. I said it'd be bulk billed through the public system since he had a work visa. No charge to him. He froze, said that's impossible. A full physical with blood tests. That's $800 to $1,000 easy. I showed him how the system worked. He insisted there must be a delay, that he'd get a surprise bill in a few months. Made me write a note confirming 0 charges. 3 months later, he came back for a follow-up, brought the note, asked if the bill had been processed yet. Still couldn't accept that he'd received comprehensive health care without paying directly. My wife's a social worker in Glasgow, and she helped an American student who'd been avoiding getting a persistent cough checked because she was terrified of medical debt. The cough had lasted 2 months, getting worse. My wife convinced her to go to the GP. The student went, saw the doctor, got a chest x-ray, received antibiotics, came back to my wife in tears. Not from relief, but from confusion. They didn't charge me anything, she kept saying. Not even a copay. My wife explained the NHS. The student said she understood the concept, but couldn't process the reality. She'd spent her whole life associating healthcare with financial anxiety. Couldn't separate the two. Asked my wife if she should send a thank you payment to the clinic because she felt weird about taking services without paying. I'm a paramedic in Copenhagen. And we got called to a hotel where an American businessman had chest pains. Minor issue, probably anxiety, but he needed checking. We arrived, did basic assessments, said we'd take him to hospital for an ECG to be safe. He refused to get on the stretcher until we told him the ambulance fee. My partner said there isn't one. The guy laughed, said, "Come on, what's the real number?" We insisted it's free, part of public services. He said that's communism, that someone pays. Demanded to know the taxpayer cost per ride. My partner said maybe a few thousand kroner in public funding, not his problem. The American pulled out his phone, tried to wire us money directly, said he wouldn't be a burden on Danish taxpayers. We had to explain we legally couldn't accept payment. He came to hospital still offering to pay, seemed more stressed about the lack of a bill than his chest pains. My sister manages a pharmacy in Brisbane, and an American tourist came in needing an EpiPen refill, severely allergic to shellfish. She asked the price. My sister said around $100 Australian, maybe less with a prescription. The woman went pale, said she'd pay it but asked if we had payment plans. My sister was confused. The woman explained that back home, EpiPens cost $700, and she'd expected similar here, had budgeted accordingly. When my sister confirmed the price was really just $100, the woman teared up. She bought 2, said she'd never been able to afford a backup before, always risked having just one. Left saying she couldn't believe life-saving medication could be this affordable. Kept thanking my sister like she'd done her a personal favor instead of just doing her job. I work at a medical center in Vancouver, and an American couple brought their kid in with a broken collarbone from skateboarding. Standard injury, needed an x-ray and a sling. The dad asked for a cost estimate before we'd even examined the child. I said it'd likely be covered under provincial insurance. He said they were visiting, didn't have Canadian insurance. I explained that emergency services are still provided, billing sorted later, often minimal. He didn't buy it, said they'd rather drive back across the border to an American urgent care they trusted. I had to get a doctor to insist the kid needed immediate care, that the border was hours away. They agreed reluctantly. Total bill was $300 Canadian. The dad said he'd budgeted $3,000 minimum. Asked if we'd calculated wrong. Seemed disappointed that his financial anxiety had been for nothing. My cousins, an emergency nurse in Stockholm, an American au pair came in after fainting at a park, dehydrated and malnourished. Turned out she'd been skipping meals to save money in case she needed medical care while abroad, keeping an emergency fund. We treated her, kept her overnight for observation, ran tests. She kept asking nurses what her running total was, visibly stressed. My cousin finally sat down with her, explained everything was covered under Swedish healthcare, that even visitors get emergency care. The au pair cried. Said she'd been rationing food for 2 months because she was terrified of getting sick without insurance. My cousin asked why she hadn't looked up how Swedish healthcare worked. She said she'd assumed it was like America, but maybe cheaper. Hadn't imagined it could be fundamentally different. I'm a ski patrol coordinator in Whistler, and we rescued an American snowboarder who'd hit a tree, possible concussion. Standard extraction, we stabilized him, called for the ambulance to meet us at base. He regained full consciousness on the sled ride down. First thing he asked was whether ski patrol charged separately from the ambulance. I said, ski patrol's included in his lift ticket, ambulance would be about $80 Canadian. He started laughing, said, yeah, right. Just tell me the real price. I insisted that was it. He said ambulances in Colorado cost $2,000 minimum, that Canadian healthcare was supposed to be similar to American. I told him he was wrong. He argued with me while concussed, said I was lowballing him, that he'd rather his friends drive him than get hit with a surprise bill. Made us cancel the ambulance. His friends drove him to emergency, where he paid nothing beyond the ambulance fee. He'd refuse. My brother's a lifeguard in Sydney, and he pulled an American tourist from a rip current, conscious but panicked and swallowing water. We called an ambulance as protocol. The guy refused treatment, said he was fine, clearly wasn't. Started arguing he couldn't afford an ambulance for nearly drowning. My brother explained NSW ambulance fees are like $400 for non-residents, serious but not insane. The American said $400 was lowball, that he knew ambulances cost thousands. My brother said, maybe in America, not here. The guy insisted my brother didn't understand American healthcare costs, tried to educate him on it while coughing up seawater. Eventually accepted the ambulance. Complained the whole way about expecting a huge bill. Got the invoice for exactly what my brother said. Called back to ask if they'd forgotten to charge him properly. I worked dispatch for ambulance services in Montreal, and I took a call from an American woman whose husband was having a stroke, clear speech slurring, facial droop. She wanted to know the cost before confirming the ambulance. I said we'd send it immediately. Cost wasn't relevant during an emergency. She said cost was absolutely relevant, that they were tourists, uninsured in Canada. I told her we'd bill later. Treatment comes first. She hesitated, asked for a ballpark. One said a few hundred Canadian dollars maybe. She said that's impossible for a stroke emergency, that this cost $15,000 minimum in America. I told her Canada is in America. She authorized the ambulance but made me note on the file that she'd been quoted a few hundred, like she thought I'd trick her. Her husband recovered fine. The bill was $200. She called to confirm we hadn't missed adding zeros. My uncle's a doctor in Auckland, and an American grad student came to emergency with appendicitis, needed surgery. Clear-cut case, appendix about to burst. The student refused surgery until someone gave him a price. My uncle said they'd sort billing after, that this was life-threatening. The student said he'd rather fly back to America and use his insurance there than get surprise billed for $50,000 in New Zealand. My uncle had to explain that appendectomy here might cost him a few thousand at most as a visitor. Possibly nothing if he had student health coverage. The guy didn't believe it, said my uncle was either lying or didn't understand his own healthcare system. Appendectomies cost $30,000 to $50,000, he said. That's universal. My uncle had to get a hospital administrator to show him the fee schedule before he'd consent. Had surgery, stayed 2 days. Total bill was 1,800 New Zealand dollars. Kept asking if they'd processed his insurance wrong. I'm a paramedic in Bergen. And last week we picked up an American woman who'd fallen hiking, suspected fractured hip. She cried the entire ride to hospital. Not from pain, but from fear of the bill. Kept saying she'd have to sell her car, maybe her house, that this would destroy her financially. We tried calming her, said Norway would bill her insurance. Cost wouldn't be American level. She didn't hear us, just kept panicking about money. At hospital, after surgery, after recovery, she got her bill. 4,000 euros total. She stared at it silent, then asked the billing office if this was the bill for just the ambulance. They said no, everything included. She broke down again, but different this time. The saddest part isn't that they don't trust us. It's that they've been trained so thoroughly to fear healthcare costs that they can't recognize care when it's actually accessible. They've spent whole lives learning that medical treatment means financial ruin, and one trip abroad can't undo that. We'll keep picking them up, treating them, watching them panic over bills that never come or come smaller than their lowest imagination, and they'll keep going home with stories about how healthcare works elsewhere. It's probably still not quite believing it was real.